Over the last several months, resignations of top leaders, fraud allegations, and overpayments to 2 Indian tribes have prompted increased scrutiny of the Department of Human Services. Senate committees looked into the controversy.
DHS has been in the news more than they should be. So regardless of commissioner or governor, there have been problems at the Department of Human Services as long as I've been at the legislature. Program integrity, eligibility, project management, transparency, accountability. These problems result in legislative whack-a-mole.
Fraud is a serious problem in the CCAP program. And we also revealed to you that the internal controls are so lacking that it really isn't that hard to steal money from that program.
We should pay the leadership better and require professional management. The budget of DHS is over 4 times that of the University of Minnesota, yet the commissioner is underpaid for this level of responsibility. The acting commissioner and the new commissioner should immediately evaluate the current roles and the distribution of authority and decision-making in the healthcare administration and bring experienced professional leaders who have worked in the trenches and healthcare system into the organization. We should require that the leadership of the clinical policy areas is a physician and a team led by physicians reporting directly to the agency commissioners. The physician should be the final stop for clinical decisions.
We are concerned at how the Department of Human Services has handled these allegations that we were somehow overpaid. There was no consultation with us. There was no respect for our sovereign status.
I have not found any issue about impropriety. I have not found any issue about any kind of criminal activity. There is no scandal. There is no chaos. I think it's time to move on.
Yes, there are many relationships on this panel with Senator Loehrke and Commissioner Loehrke. That's true, to be sure. But I think what we're getting at really has very little to do with individuals, and it has more to do with what Senator Benson said, where if indeed a governor-appointed commissioner comes in and identifies, after having been in the trenches with us on this committee for years, and identifies the need for change and understands the purpose of the Blue Ribbon panel and the challenges of the late night budget sessions that have gone on for the preceding 4 years. And then there could potentially be some, if you will, let's talk about the elephant in the room. If there's a mutiny within because this is uncomfortable, and then the end result is that the commissioner leaves, the governor-appointed commissioner leaves, then what does the culture look for? What will that look like in the future, and how will that be established, that culture of reform and change? And how will we have accountability of the department determined? And how will individual performance be determined and measured? And what metrics will be used? So I keep coming back to the word, over the last couple weeks, I keep thinking about the word CAP, because it's all for me about culture, accountability, and performance.
There is grave concern. Any organization where 4 key leaders turn over means there's something bigger than just personal issues going on, because personal issues can be resolved. They can be walked through. They can be dealt with in an orderly manner. And so we're not done yet trying to figure out how we're going to help DHS be ready for what's next.
Joining me is the chair of the Senate Human Services Committee, Senator Michelle Benson. Welcome.
Glad to be here. Thank you for inviting me.
Today, you've begun your due diligence as chair of the Human Services Committee to provide legislative oversight into the recent problems at DHS, which include resignations of top officials, overpayments to tribal governments, alleged fraud within the Child Care Assistance Program, and the treatment of whistleblowers. How extensive is the Senate's role in oversight?
It is actually in our Constitution. So we have confirmation of the commissioners. And so that lays out right there that we have a unique responsibility. The House has responsibility for the finance. All spending begins in the House. Senate has executive oversight. And if you even look at the Capitol, the Senate sits above the office of the governor. So we literally look over the office of the governor in the structure of the Capitol.
And so in light of these problems, it is within your constitutional responsibility to really look into what's been going on.
Absolutely, and also as an elected official, we are the representative of the people. And I think there are a lot of people in the state of Minnesota who believe DHS is mismanaged, and is it living down to that expectation, I think is a question that this commissioner and the next commissioner need to ask. It should be living up to the best expectations of Minnesotans, not living down to the lowest expectations. And so we want to make sure that that is voiced and that we put the Department of Human Services on a path to the best performance.
Yesterday, Governor Walz appointed Jody Harpstead to take over the agency. She'll begin September 3rd. She brings with her significant experience in the private sector as well as a Master of Business Administration or MBA degree. I know that you're not yet acquainted, but do you believe that a skill set that includes experience in business management might provide a new direction for DHS?
And I was so pleased to see that she had human resources experience. She has actually been responsible for P&L deliverables, profit and loss statement deliverables. And so it is a huge agency, and there's nothing like being a DHS commissioner. But to have large organizational management, I think, is critical to understanding the dynamics of an agency that's that large, but also the accountability. Where do you look for? What metrics do you put in place to make sure that you're getting the best out of your people and the best out of your programs? And so I am hopeful that her private sector experience will be maybe disruptive, but definitely reforming in the way DHS operates.
Well, and possibly this will go along with the recommendation of Dr. Jeff Schiff, who is the former medical director for the state's Medicare program. He testified before the committee today. One of his recommendations was that agency leaders have that experience in healthcare and management. In a sense, I think he's advocating for more professionalization of the agency. So does Governor Walz's pick potentially fit with that new direction?
I think it's an indication that he is building off of the successes he had with MNLARS, where somebody from the private sector came in and gave advice and counsel. But I don't think I'd go as far as Dr. Schiff, but I think an oversight committee or sort of board of directors with specialists in each of the areas, maybe 6 topical areas. Let's not forget, Minnesota has the arguably world's best healthcare system. We have great nonprofit health programs, as well as programs like Lutheran Social Services that work with the disabled. So what if an expert from key areas, United Health Group's program integrity, what if that vice president was on a board that said, are you using industry best practices? As you're looking at a vendor to improve this program, are you asking them these key questions? Because one of the concerns I think we all should have is that we live in our fishbowl and we think all of the answers are in our fishbowl, and we need to break out of that and seek outside direction as we go through big changes. And I think now would be the time to have a good conversation about that.
And you touched on this just briefly when you mentioned oversight, because considering the size of DHS, the legislative auditor has done several investigations targeted at different areas recently, and I'm wondering, does the legislative auditor really just need to have ongoing investigations into various aspects, or does there need to be a separate oversight commission or group or something? Like, it's such a big agency. What helps the Senate do its due diligence?
Well, first of all, the legislative auditor does have staff there permanently. They permanently investigate and audit programs because the legislature funded them and gave them that direction. And that's how we're finding many of these things. Secondly, I think the Office of Inspector General should be outside the purview of the commissioner, so that to meet the internal needs of DHS, there's an inspector who can report criminal activity to BCA, but doesn't have to report to a commissioner that's responsible for the programs. And so I think those 2 things could do a lot towards helping DHS improve program integrity and internal accountability.
Speaking of breaking things up, you just mentioned too the idea of breaking up the agency, because it is, I keep hearing, $39 billion budget and 6,700 employees. It's been bandied about by both Republicans and Democrats. The new commissioner appointee was asked this question. It's on the table. What are your thoughts on dividing up DHS into smaller entities?
What I'd like to do is start having hearings so that we understand. I think my bias is there's a natural cleaving point at direct care and treatment because it is a complex hospital system that deserves to stand alone. It's got a budget bigger than the Department of Agriculture, and it's responsible for some of our most difficult and challenging citizens as they are in recovery as sex offenders or mentally ill and dangerous and need to be brought through treatment. And so I feel like that's a natural cleave point, but that doesn't necessarily mean it's a good idea. And so I think we need to have hearings to talk about that. I'm open to other ideas as to where we might have a breakup of the agency, but I think just the fact that that one hospital system could be managed as a standalone is a good idea to congeal a conversation.
Acting Commissioner Pam Wheelock said today that in her it's a short period that she's filling, but that it's an incredibly demanding job because of the size of the agency. She said one of the challenges is that the managers and directors that work underneath her sometimes have bigger budgets, more staff, multiple programs than some commissioners of entire agencies, as you said. How does a new commissioner handle all that when these people underneath don't necessarily have the authority that they maybe need to make good decisions, but the commissioner is somewhat removed or can't be everywhere at once?
And I think that can be a communication and an authority designation. If you think about chain of command, as long as there's trust on the chain of command, then the commissioner's authority moves down that line. But then it needs to be clear that if you step outside chain of command, for people who aren't familiar with the military, it's that there is somebody who is responsible for that ship, for that fort, for that particular battle, and everyone needs to be trained and they need to follow orders in order to accomplish the mission. And so the people along that chain of command have the authority to act on behalf of the commander. And so that might be harsh for some people to hear, but if the commissioner says to the deputies, I give you this mission and I give you the authority to act on it to accomplish that mission, then that commissioner's authority needs to carry forward to each employee to be on mission. But they need to be adequately trained, they need to be respected and listened to, and best practices need to feed back up then that chain of command.
What's next in terms of your committee? Another meeting in the future? What are you hoping to find out?
We are planning on having more meetings. I don't believe we're scheduling one for next week, but the week after. And we need to see where we're at with the OIG investigation. We need to see where we're at with the overpayment investigation, what information we're getting from the data practices request we submitted. But there was also some hiccups with procurement. There are some people who aren't happy about the way our prepaid medical assistance program was managed, so that is on the agenda. The breakup of DHS, if that's what's going to happen, the appropriate role for the Office of the Inspector General, and then we're going to have a new commissioner to meet as well. And so the breadth of the work that's in front of us says that there will be more hearings, and they will come one after another as we go into the fall and winter.
So much to do. Senator Benson, thank you.
Thank you.